My sincere apologies that I'm speaking in English. I wish my schoolboy French was better, but I hope you will understand. Thank you. Well, firstly, I'd just like to thank Marie-Odile for her, not just for her invitation to be here today, and also see so many old friends in the audience too, because I've been here many times before, and but for her leadership in this space in France, and I've been learning yesterday about the progress, and hopefully today you can make a lot more progress. So thank you for asking me to be here. It's a big privilege to be in this beautiful surroundings and this wonderful place. So thank you. So one of the concepts that we have been working with in Australia and internationally is this idea of mental wealth. You know, we talk about mental health, but mental wealth is something a little bit different. Mental wealth is the social capital that we invest and we create in young people when they go from little babies, you know, to become the 22-year-old on the threshold of adult life. And if that young person doesn't fulfill their potential, doesn't make a contribution to society, that's a disaster, not just for that individual and their family, but it's also for the society, because if you think of all this whole generation of young people that don't succeed in life, and the main reason they don't, the number one reason by far is mental ill health and mental illness. It's the main reason that young people either die or end up on social welfare and don't in a life of poverty, or they don't fulfill their potential. So instead of becoming a nuclear scientist, they become a cleaner. You know? That's a waste of human potential. And much of that is reversible and preventable. So that is what we are doing, this audience. We are part of this mission to prevent that from happening. So what I'm going to try and do is talk about the current state of mental health across the world, with some data, and it would be good to know what the French data is showing about this. And then I'm going to talk about the solutions which you've all been working on in different ways and how we can change that. So that's, hopefully I can cover all that in half an hour. So, thanks. So this is the state of, this is an international survey. It's more of well-being than mental illness, but it shows that across 6 continents, the mental health of young people in this teenage, young adult period is the worst across the whole lifespan. If you look at older people, strangely enough, the mental health of older people is much better than younger people. And it continues to improve through life in terms of well-being and positive mental health. So next, thanks. And of course, you all know this, but mental health is the main health problem of young people. 63 to 75% of onsets of significant adult-type mental illnesses occur by age 25. It's the main health and social issue, with 45% of the burden of disease in this age group. So we don't need big cancer centres for teenagers and young adults. We don't need diabetic centres or you know, asthma centres. Their main health problem is mental ill health. And yet, where do you find these centres? Where is the system, you know, to support that? It's not the mainstream health system, not as we know it anyway. And the problem is, as we've been working on this, the pioneers around the world, like you in the audience, Marie-Odile, and all your colleagues here in France and we in Australia, we've been working on this. But as we've been building the aeroplane, the problem is getting worse. The headwinds, the problem is deteriorating across the world. So I'll go through that now. So this is, you've seen this picture before, maybe, you know, mental illness is the mirror image of physical illness in terms of its timing in the life cycle. So all the new cases of schizophrenia, anorexia, borderline personality, they all occur in this age group, and peaking in the teens and late and early 20s. And after that, we get chronic cases. Yes, people who didn't get better, but there's not as much new cases after that. But physical illness is the opposite. It's in younger children, or it's in the over 50s. And in the middle of life these days, most people in high-income countries are quite healthy in middle age. You don't see people dying of tuberculosis or the things that killed people in the 1930s and 40s. Okay, next. But this is changing. Next. The Surgeon General in the US, before the current president got rid of him, along with a number of other people, he made the point in 2021 that we are dealing with a youth mental health crisis. And he said that the challenges today's generation of young people face are unprecedented and uniquely hard to navigate, and the effect these challenges have had on their mental health is devastating. Now, that was in a way a strange thing to say, because, you know, other generations of young people have been through world wars, Great Depressions, but it's still the case that this generation of young people have got worse mental health than any other generation before. And he was calling that out. Yeah, next. We published a paper saying the same thing in the Medical Journal of Australia, looking at the data from Australia. We published this with a child psychiatrist, a youth psychiatrist, which was me, and an adult psychiatrist. 3 types of psychiatrists, or maybe 4, if you include old age psychiatry. So you have child psychiatrists, youth psychiatrists, adult psychiatrists, and old age psychiatrists. That is where we are going. That's where we want to be. Not linking the child and adolescent so strongly, and not cutting it off from the adults. There has to be like a spectrum, but there's a special set of skills and cultures that are associated with this transition from puberty to adult life. That is what we are building. Next. So, I don't know if you have seen this much in the French literature, but we published in Lancet Psychiatry last year a piece of work that lasted for 4 or 5 years, the Lancet Commission on Youth Mental Health. Next, thanks. And why is that important? Well, first of all, it's the Lancet. This is one of the top medical journals in the world. And they publish a series of commissions, which means, you know, a large piece of work on something like HIV or climate change and health or big topics. And so youth mental health, they said, is a big topic, and we'll have a commission on that. And we published it with 54 authors from, I can't remember how many different countries, but many, many different parts of the world, including low and middle income countries. And there were 10 young people who were co-authors of this piece of work. This is the first time we ever published with young people who had lived experience of mental illness. And it was amazing, you know, people from Brazil, people from Africa were helping us write this scientific paper. And there was a youth editor who was a young psychiatrist in his 20s from Zambia, named Dalal. So he was one of the editors of this piece. So, yeah. So I think that contains a lot of the information that I'm talking about today. If you have a chance to read that, I can send you the PDF if you're interested. Next. And in that commission, we looked at the data from around the world over the last 15 to 20 years on the mental health of young people, or the level of mental illness actually in young people. Now, clearly there's been a big increase in distress, which is not the same thing as mental illness, but the distress levels have gone up. And in these countries, particularly the Australian data, we did diagnostic interviews in the population across the lifespan. And it was a proper epidemiological study which sampled properly, so we got a very good idea of the true prevalence, not related to help seeking or self-diagnosis or anything, just diagnostic criteria in the community. And what we found was the level of mental ill health. Can I have the next one, please? Oh, sorry. Go back. Yeah. We showed a 50% increase. So it went from 26% of teenagers and young adults in 2007 to 39% in 2021. So that's a 50% increase in prevalence, so that 2 out of 5 young people had met diagnostic criteria for a need for care of some sort. So that's 2 out of 5. If you think of a class of say 30 students, that's 2 out of 5 of that class. That's, what does that work out to? Something like 12 kids out of 30 need help. Okay, and that wasn't the case 15 years ago. So, okay, next. And you can see that just even in the last few years, and this is probably the effect of the pandemic there, you can see the pandemic had a much worse effect on the teenagers and even the young adults. than in the middle age and older people. Okay, I'll come back to the pandemic in a minute. And the burden of disease associated with, it's very hard to read this, but the burden of disease in the younger age groups has gone up, as explained by mental illness. So all of the data is pointing to the same thing. The mental health of younger people, Generation Z, and even a little bit of the one before, is getting worse. And that's not the case for middle-aged people or older people. Yep. Okay, next. So this is the study I was telling you about. It's a very well done study by the Australian Bureau of Statistics. And it's the only other studies that are of similar quality would be from Scandinavia and those sort of places, I would say. The US data is not so clear. So this is the data from the Australian survey. You can see that in the 16 to 24 age group, it's 39% across the two genders, or the various genders, and it's 39% there. But the young women, it's worse. So the trend was worse in young females than it was in young men. And we don't know why. We're not sure why that is the case. Next. So that's comparing the different surveys across the years. Next, thanks. There's another survey we do in Australia, which is done every year in every single household. And it looks at employment, it looks at the financial situation of the families. Everything is recorded, and including a mental health measure called the SF-36. And you can see that over a 20-year period, there's been a steady decline in the younger, in the mental health of the younger cohorts, but particularly the effect of the pandemic on the right. You can see how bad the pandemic was for young people. Next. So many of you will be familiar with this slide, which is the spectrum of care, really. It starts off with prevention on the left, like universal forms of prevention where the whole population is worked with, then high-risk groups, and then early-stage illness and early intervention, and then more standard treatment on the right. So, and of course, in psychiatry, most of the resources are still devoted to, the ambulances at the bottom of the cliff, the people on the right who've got serious long-term illnesses or acute illnesses, and it's very hard to get resources spent on the front end, getting ahead of the curve in terms of early-stage treatment, which obviously every other area of healthcare is very concerned about that. In cancer, everyone is trying to get to early diagnosis. People don't want to put all the resources into palliative care. They want to treat palliative care, but they don't put all the resources there. They put a lot of resources into early diagnosis and early treatment and proactive treatment. So that's what this slide is about, trying to work out where the effort should be. And when you see a big rise in prevalence like we've seen, you have to think more about prevention too. What is going on with our society that is causing such a terrible decline in the mental health of young people? What's the reason for that? Okay, next. So you either think that the existing risk factors like child neglect or disadvantage or child abuse or other risk factors that we know about, either they've got a lot worse or something else has happened. Something new is happening in society. So if it's something new, what could it be? And this is where this idea of megatrends comes in. So first of all, I've already said this, I suppose, but we have neglected young people across history, and you see these quotes from Socrates and Shakespeare about that, but this is a quote from Bobby Duffy, who, Professor of Public Policy at KCL, talks about the timeless denigration of young people. And young people get blamed for the problems that they are manifesting. They're called snowflakes. They're not resilient enough, So it's their fault that they've got mental health problems. It's not our fault, or it's not society's fault. So I'll keep going. Yeah. And then the generations are changing. Gen Z, which is the current group that we treat, they're qualitatively different from Gen Y. There's been some changes in their culture, in their developmental pathways and their attitudes. And these have been described in these two books by Bobby Duffy on the one hand in the UK and Jean Twenge in the US. I won't go through all of those, but I'm sure you're very familiar with these changes if you're working with young people. Next. Yeah, so what are the global, I'm going to go through these so we can skip this slide. The Surgeon General looked at the usual suspects, and there are a lot of risk factors known. Now, either of these have got worse, or we've got new issues to deal with. And this quote, I don't know if you understand this in the same way in French, but Richard Eckersley described young people as the miners' canaries of society, because the coal miners in the old days used to take a canary into the coal mine to detect the presence of dangerous gases. And so it was like an early warning system. And in a way, young people are the early warning system for our society. If they are failing, if they are getting a lot more serious problems, that's a warning signal to the whole society. What is going wrong with our world that's causing this? Okay, next. So COVID obviously was one thing. There was definitely really good evidence that young people were differentially affected. Their mental health problems got a lot worse. It's particularly certain subgroups, young women and LGBTIQ, were more adversely affected. And in Australia, First Nations people. So another possible cause is social media. Now, there's a bit of moral panic about this. You know, in our government, I'll tell you about that in a minute, but Surgeon General did point out the harmful effects. It's okay, next slide. Next one. Oh, sorry, back one. Yeah, okay. So he pointed out the harmful effects, but he also stressed some positives as well. There was some positive effects of social media for young people too. And in a way, it's kind of part of their digital world. They're digital natives. So what to do about it? What to do about the harmful effects? Next. And this fellow, this is a bestseller in the English-speaking world. I don't know if it is here. Jonathan Haidt. He wrote a book about maybe 15 years ago called The Coddling of the American Mind, which was about how overprotective parenting had made children more vulnerable to the effects of stress and life. So they looked more resilient because they'd been overprotected and not really exposed to appropriate amounts of risk in childhood. Some truth in that, I think. But I think he's made an overreach now with this latest book, even though it's very compelling. It's a very compelling book. If you read that book, like politicians have read, they think, wow, this is the solution. All we need to do is shut down social media and everything will be okay for young people. And that's sort of what he's trying to say. Very simplistic. He's not really a researcher. He's a populist. He works in a business school, but he's presenting himself as a social researcher. And he's very compelling. But now, that's not to say there aren't harmful effects of social media, but he's explaining everything on that basis, and that's an example of, next slide, you know, for every complex problem, there's a solution which is clear, simple, and wrong. Okay. And our government was sold, though. They bought it. So they banned all young people from using social media till the age of 16. That is happening now. Now, whether they can actually do that or not is another question, but they've passed laws to actually prevent that from happening. So maybe it's a natural experiment. This is a cartoon from an Australian newspaper, and it really is, what it says is, deep water is risky, we should teach our children to swim. Social media is risky, we should ban kids from using it. So the idea is, why don't we just adapt to it and make it safe? So for swimming, you teach the kids to swim and you put a lifeguard on duty. But no, we're going to ban any access. So that's our government's approach. Yeah, next. Climate anxiety is another big mega trend. You know, young people in particular are really worried about the future. And like we all probably are worried about the future, but if you talk to them, it's a definite source of anxiety for them. So it's another big mega trend. It's got its own origins, which in something else, which I'll talk about in a sec, but certainly that's one issue. Next. So it says, yes, the planet got destroyed, but for a beautiful moment in time, we created a lot of value for shareholders. So that's kind of what's happening. Okay. Now, economic factors. We think, in the Commission, we thought this was a very important one, socio-economic factors. Next. So what's happened, this is not a political lecture, but what's happened in the last 30, 40 years, after the Second World War, we had a welfare state. You know, we had Keynesian economics. You know, we had a different economic theory, and the world came together in a much more collectivistic sort of way. But then in the 1970s and 1980s, the ideas of Friedrich Hayek, the philosopher, took hold in Margaret Thatcher and Ronald Reagan, and supported by the Chicago School of Economics, the Friedmanites. And they took over, so much so that that is seen as the only economic theory in the world now, almost. It's can I have the next one? So a book written by a British journalist called George Monbiot is The Invisible Doctrine. And he calls it the Invisible Doctrine because it's invisible. Everyone assumes that the market is the only way to operate an economy and operate a society. And that government intervention, government is bad, the public services are bad, everything is done better by the private sector. We privatize everything. Now, that hasn't as been bad in Europe as it is in Australia and UK and obviously the US, but it's a creeping, you know, almost like a virus, you know, across the world, which has fragmented a lot of things. It's created two-tier systems of health and education. It's turned everything into a commodity. It's made people much more individualistic. And he describes all the effects of that in this amazing book. It's only 150 pages. Next. And in London, there's a museum of neoliberalism, but unfortunately, it's not yet a museum. So an Australian author called Alison Pennington described all of these changes. So that has led to casualisation of the workforce. So unions are weak. You know, the conditions for young workers are very, very reduced. They've got unstable work. That's why they were badly affected by COVID as well. They can't buy houses. The house prices have gone up to 10 times the median income from 3 times the median income. Rents are impossible. It may not be in every country, but certainly in many high-income countries, these things have happened. And even social media and climate change, you can trace the problems there down to, you know, unrestrained capitalism and neoliberalism. So the idea is that these economic forces, which have been unleashed over the last 30, 40 years, without people really realising their effects, are causing effects on mental health and well-being of the emerging generations. That's the hypothesis. Now, you might disagree with that. I'm sure, depending where you sit on the political spectrum, you know there will be people that definitely will disagree with that. But that's definitely a theory that can be looked at. Next, for example, house prices. For people in my age group, it cost 3 times my income when I bought my house to buy the house. Now it's 10 times for someone entering the housing market. So that insecurity that's introduced into that person's life, that loss of future, loss of a secure future, that is a very powerful society-wide effect on generations coming through. Next. And inequality. We know that inequality is bad for lots of things, you know, like incarceration rates, teenage pregnancy, homelessness, mental illness. Every social problem or health problem you look at is made worse by a greater degree of inequality in a society. And these British authors showed that countries like Japan and Norway, which have very low levels of inequality, are functioning much better than societies like Brazil or Paraguay or the United States, which have very high levels of inequality. So these are the sort of forces, and that's getting a lot worse, and so is the intergenerational inequality getting worse. Next. So we now have 200 billionaires in Australia who own something like 25% of GDP or equivalent. 20 years ago, we only had 20 billionaires who owned 8% of GDP. So the wealth is going upwards, not downwards. Next. And Vikram Patel, who I'm sure you all know is a very well-known psychiatrist in global mental health, he's written very powerfully about this in The Lancet as well. These harmful social policies, harmful economic policies that damage the mental health of communities. And so it becomes a political question at some point. Yeah. So just to summarise that bit, mental ill health has always been the key issue of young people, but it's getting worse, particularly for young women. It's unlikely to be due to changes in our brains or our genes, but much more likely to be due to changes in society and our communities. Okay. So the paradigm shift that we need, and I think many people in the room agree with, is instead of having child and adolescent, adult and old age psychiatry, we need to strengthen this youth transitional zone. Now, it can still be linked to child and adult, but it needs its own space. Next. So in Australia, this is Origin, where I work. That's our view of the world, by the way. It's a big globe, but it's actually in London, and it's not actually in Australia, that thing on the left. It's outside the London School of Economics. So we're at the top of the world there. And that's our facility, our mothership in Melbourne. It used to be very run down and dilapidated buildings, but about 5 years ago we got this new build which integrated all of the research and the clinical care in one place, which is in a beautiful parkland just near the centre of the city too. So we're very lucky to have this space. Next. So our story, very much like you, we began with early intervention in psychosis with EPIC back in the early 90s. And we developed a system of care to do early diagnosis and detection of psychotic illnesses like schizophrenia and other psychotic illnesses. And that was, a prototype in a way for a much bigger reform around all emerging mental disorders in young people, which we moved to in the early 2000s when we became Origin. And then a few years after that, we founded a thing called Headspace, which I'll tell you about, which is like a primary care model, a bit like your Maison des Adolescents in intent, but more entry level, not specialist level. Because we needed to deal with very large numbers of cases. If you just have a specialised service, you can't treat the huge prevalence. But if you have too basic a service, you can't treat in an effective way the more complex problems. So you need both tiers of service. And then we evolved it into the National Centre of Excellence in Youth Mental Health and then a series of other things. So it's been like a reinvention, a series of reinventions of focus and trying to so pursue this mission. We call it a mission, a bit like the moon landing. In 10 years, we will be on the moon. How are we going to get there? Well, we have to invent the technology. We have to get the resources. And so it's like a creative mission, which is scientific, but it's also sociological and political as well. Next. So what conceptual frameworks did we need? Well, we definitely need developmental thinking. The fact that we're dealing with young people who are coming out of childhood and they're aiming for a mature adulthood, stable, mature adulthood. That is a massive developmental challenge with a series of stages and steps. We have to understand that if we're going to work with them. And we have to modernise the thinking about that too, because each generation is developing in a different way and there are different challenges. So that's one paradigm. The other one is staging, which we developed from cancer, and it came out of our psychosis work, that there are different stages of illness, and you want to intervene at the earliest stage, and the treatment in the earlier stages is different from the late stages. When I started psychiatry, schizophrenia was schizophrenia. It didn't really matter whether it was the first time you had it or the 50th time you had it. But it's very different in the early stages from the later stages. And not everyone gets to the later stages. And you want to try to reduce the risk of getting to the later stages. So that idea is very simple, but it comes from medicine. And it's got very much applicability in psychiatry. Maybe in a slightly different way. So we developed different ways of thinking about that. We called the early stages the microphenotypes, where it's not that clear what's really wrong, but they have got symptoms, and they're getting functionally impaired, but they don't fit the textbooks yet. So what do you do at that point? And then at later stages, you get more clear-cut pictures, but even then, those pictures overlap with each other. So you can have what looks like a schizophrenia phenotype, but you also have depression, or you might also have body image problems or borderline problems. So what do you call it? I mean, you've got multiple treatment needs. So this is still an ongoing debate. So that's another conceptual framework. Next. Yeah, and these are all the other things that we all talk about. We can keep going. So having the right sort of mindset, the right theory, and the right tools, and the right culture. So the next bit is about the culture. so building a field in which young people get youth-specific, developmentally appropriate care. Now, we were talking yesterday about the mess that is the current system, and you're going to fix that this afternoon, or later this morning, I know, you're going to work on that. This is when we started. So what we thought was, you have primary care, you have general practitioners. It doesn't really work for young people, so you probably need a new form of primary care for the young people, which is, we call it Headspace, and now, and maybe your maison d'adolescence could become that, you know, or maybe it already is. But it needs primary care thinking. You know, it's not a specialist service. And then there's a secondary level, which is the community-based, community mental health, basically. It's not hospitals, it's platforms of care in the community. But in Australia, it's delivered by a mixture of government, non-government organisations, all with very confusing criteria, and it's all fragmented, partly due to neoliberalism, which treats it as a market and commissions different sort of services for different people. So I remember going to Ireland in Dublin one time when the Jigsaw program was developing, and in one small area of Dublin, they had 250 NGOs operating, providing health and social services. It's just a joke, you know. I mean, there are more people sitting in front of computers than ever seeing patients, you know. It's just a mess. So how do we streamline that into a much more coherent, only with more centralised planning, you know, and collaborative commissioning of services, not competitive commissioning of services. I don't know if that's a problem in France, but certainly in English-speaking countries, this market-based commissioning creates that. And then you have the tertiary system, which is really just acute care and chronic care, and it's not really linked into this sort of model properly, and it's hard to get from different levels, from one level to the next. Bottlenecks. Okay. So I don't know if you can read this as a Larson cartoon. It says inconvenience stores. And that's really what the young people felt when they looked at our system of care, our child and adolescent adult system of care. They didn't feel like it really felt safe or comfortable for them. And so how to fix that? Well, the main way is to co-design the services with the young people. And that's what we have done with Headspace and Origin. You know, so co-design and youth input is very important. And this is the problem. We were talking about this yesterday, the resistance to change in the system. You know, when you come to other traditional psychiatrists or, you know, the public services, the bureaucrats, and they don't actually see the need for change a lot of the time. And so you have this problem with innovation, early adopters. I think the room is probably full of a lot of early adopters and innovators, and then the late adopters, these are people that need a bit more persuading. That's okay, they're a little bit more conservative, they just need more evidence, but they're not really opposing it. They're just a bit of inertia there and a bit of conservatism. They're okay too, you have to respect that. But then there's a group of saboteurs, you know, who try to stop you from doing any reform. And they're protecting vested interests or they're just against everything. They're contrarian. So this is a sort of a reform process. Next, so let's look at some of the progress, a new architecture of culture and culture of care. The first thing was to build a primary care system, because in our catchment area in Melbourne, we cover about maybe 2 million people. And there were maybe 60 or 70,000 young people in our catchment area who had a diagnosable need for care, and only 1,000 were getting treatment in our specialist youth mental health system. So what about the tens of thousands of other kids? They weren't getting the right sort of help, or any help. So we had to build a system which had much more capacity and maybe shorter episodes of care, but at least much better access to actually find them in the first place. And that became what's called Headspace in Australia. So next, thanks. So these are, from the Commission, if you read the Commission document, these are some of the features that have to be in these systems of care, according to international consensus, and also what you can do in different resource settings, what you can do in a high-income country like France, what you can do in a middle-income country, let's say like, let me think, well, we're working in the Maldives, which is like a middle-income country, you could say. Parts of India would be middle-income countries, and then low resource settings like Zambia or in Zimbabwe, where you have got very few psychiatrists, but you have got a lot of people. And so lay health workers and other sort of models of care and digital mental health can work there. So you can do something in different settings. Next. So these are the countries that have been working on this. You can see France is there. And on this paradigm, this reform paradigm. US is really not doing much at all. US is, more like a third world country in many ways in this respect. In Northern California, there are some services, but otherwise, their main reform has been in early psychosis. They have got coordinated specialty care in many centres now, which is a step forward. But for the youth mental health, they're slow. Canada, very different. So I'll just go through very quickly a few examples. Those are the countries. That's from the Lancet again. Next. So Headspace, we have 173 centres now. It began nearly 20 years ago. But over that period, we've expanded the coverage, to 173 places. There will be more. I'll show you what the latest commitment is in the federal election. That's the one I work in Coffs Harbour in New South Wales. You can see it's branded, a recognisable brand. The Prime Ministers love it. These are the collection of Prime Ministers. Every single election, every single federal election since 2006, the Prime Minister has wanted to announce mental health policies in front of a Headspace centre. So they love it, and that's why it's grown. And once you get a product that they can get political capital from, and also local political capital, because every small community can have one of these, it's a winner. It's like a domino effect. Each community wants to have this service. So that's happened in Canada as well, where they have integrated youth services. They have different brands because Canada is divided up into provinces, so the health system is provincial, so they have to have a different brand for each province, but it's the same idea, integrated entry-level youth services. And Denmark has Headspace in Denmark. It also has early psychosis programs across the country as well, so it's a very good example. They also use volunteers a lot, not just clinicians in these services. Next. So Ireland has got 19 of these jigsaw services. Next. That's what they look like. So again, there's a brand, like Maison des Laissons is a brand. And people know that's the entry level. So that's, I think you've got 134 now, is it right? It used to be 104, but now there's more. And the problem is, we were just discussing, these things need to have a standardized model of care, not just be random, not just be whatever and people feel like doing locally. There has to be, an evidence-based model of care that can be measured. That's really important for it to work. Next. So that's the one. I took out the picture of Marie O'Deal because she didn't want to be branded. But that was on the visit that we made there a few years ago. Next. So I could show you other pictures, but this is the Maldives in the Indian Ocean, where I've been going for many years, and we are building a Headspace type model on one of the northern atolls, which is going to be digitally supported, because these are hundreds of islands where the services are provided. But they also have a local platform. The local council is supporting it, and the Australian and Maldivian governments are supporting it. So this is like sort of global mental health reform that can be done across the world. Next. We've described it in different articles, like this one in World Psychiatry, and I mentioned the Commission. Next. And the World Economic Forum supported us to develop a global framework of youth mental health, which was launched just before the pandemic. Next. So that's available if you want to read that too. That's quite a good resource, particularly for low and middle income countries as well. So as well as the standardized model, you have to have local adaptation because the health financing systems are different in different parts of the world, and the workforces are different. So workforces can be a problem. Next. And so 20 years after these reforms started, we in Australia at least, we started to reimagine this and what we saw was we provided much better access, initial access to young people and families, so they can get into a primary care model and they can get some treatment for mild to moderate illnesses like depression, anxiety, and maybe just normal problems of, say, exam stress and those sorts of entry-level type things. But if they've got an emerging mental illness like schizophrenia or bipolar or borderline personality or anorexia, there's another tier of care they have to get to. There's another level which the primary care service can't fix. So that is where, you know, a new system of care needs to be built. Now, we have traditional services, child and adolescent and adult, but they're not geared, they're not linked to this primary care entry path. So we have to build a thing for what we call the missing middle. The missing middle are the people who are too complex for the primary care, but can't get into the more residual state tertiary care systems. There's a big gap between the primary care, which we created. We created the primary care, and now we've made manifest the gap which is there. Now we have to build into the gap. And that's what we've been saying to our government. Next. So that's the missing middle. So they can get into Headspace, but they can't reach the next level. Big bottleneck. So in our election in May, the Labor government, which got re-elected, it didn't do anything much in its first term of 3 years, but they promised to spend $1 billion on free mental health services. And of that $1 billion, $700 million was devoted to building a much stronger youth mental health system. And Orygen, where I work, will become the National Institute of Youth Mental Health. And we will be able to influence and guide that, because we were talking about this. When you have a network like you have to have resources to support the network and to help it to get stronger and do more effective things. So a centralised sort of leadership platform is very important, and that they've also promised to do that too. Next. So we will get 20 new youth specialist care centres in 20 regions of Australia, linked to Headspace and linked to other primary care and to schools. So these will be able to provide longer tenure care for complex and persistent conditions, particularly those 5 areas: personality disorders, eating disorders, early psychosis, mood disorders, and substance use disorders. And then Headspace itself will be strengthened, and there'll be 30 versions of what they call Headspace Plus, which has got greater capacity. So it's not going to fix everything, but it's another big piece of progress. You know, we're building a big wall. We built the bottom part of the wall. This is the next part of the wall that we're building. Next. Next, thanks. Yeah, that's just all more details of that. So what does it look like on the ground? Well, this is a figure from the Lancet. The entry level is very open. It's soft entry. You can enter digitally. You can enter in person, drop in. You can make an appointment, and you get to see an initial worker, which can be a volunteer. It can be a peer worker. It can be a clinician. But early in the course, there is a clinical assessment, and the person is allocated to the right level, whether it's a primary care level or whether it's the more specialised community mental health level, or if they're very acute, they can go straight into an inpatient unit or into a hospital in the home service. So we are trying to create this seamless, integrated sort of model, going from primary care level through to the tertiary, and ideally run by the same organisation, not 3 or 4 different organisations doing different pieces of it, but having the governance, you know, responsible as much as possible for the journey. Now that's hard because we have state governments and federal governments as funders. The state government funds the more acute and tertiary bit, and the federal government funds the other bits. So that's challenging, and it's really the organisation of healthcare, which is a bit of a mess in most countries anyway. So how do you streamline it? Next. So that's what it looks like. So we have Headspace and Orygen co-located this is in a university campus in the west of Melbourne, and the university gave us this beautiful building free of charge to put the services in. It's amazing. So the quality of the environment is good, as you can see, and it's co-designed, the layout with young people. So it feels like a place where you would like to be, you know. A lot of mental health services, you walk in, you think, oh, I don't like the look of this much, you know. And the people don't look very friendly here. So you have to make it welcoming and friendly, and lots of young people there, and the peer workers and the volunteers really help with that too. So this is possible, and you've done it anyway. But what we've done is done it in oases. We've done it in oases in a big desert. We have to make the desert to green the desert. We have to bring these oases so they're the normal thing for young people. And it's possible. So what I tried to do was show you some of I suppose, the scientific and other logic for it. I didn't show you any data about treatments or that sort of stuff. We do all that too. We are a research institute. We do clinical trials and lots of other research. But this is about, service design, cultural design, reform, making mental health, giving it equity in healthcare. So when you go into a top cancer service, my daughter-in-law is having treatment for cancer at the moment. It's amazing the quality. There's research everywhere. There's kind, friendly people treating her, and they're really expert. That should be the case in mental health for young people too. That's just their human right to have that. And if you don't do that, you're weakening the whole society. And at the same time, what I try to do is show you we need to understand, and this is a different research challenge, understand what is going wrong with our world and with our society that is causing this to be getting worse. So those are two challenges for us. Understanding and changing the world. That's an easy thing, isn't it, But at least we need to understand so we know what to do. And that's the politicians and the leaders and the community's job. But what we can do is respond to these needs in a much better way. And we need the support of the society and the political leaders to do that. So thank you very much for listening. Sorry if I went on too long, Mario.